Good afternoon, and welcome to the Mid-America Regional Council's Local Officials Briefing for Friday, June 5th. Today we'll take a look at the current situation and what's happened over the past week. I'm Mike Parker, and I'll be presenting today on behalf of the Mid-America Regional Council. Should you have any questions during the briefing, please add them to the comment section of the video, and we'll do our best to respond in a future briefing. This is our common operating picture. The KC Region COVID-19 Resource Hub is publicly available at preparemetrokc.org. The Resource Hub is updated daily with the most current information on COVID-19 cases, tests, and deaths as reported by the 9 counties in our region and Kansas City, Missouri. Today, there are 5,734 cases of COVID-19 in the region, and there have been 206 deaths. This represents an increase of 730 cases and 14 deaths over the past week. The number of people tested in the region rose to 85,509, but numbers are incomplete since not all jurisdictions are reporting. The sharp spike in testing is as a result of additional jurisdictions reporting their cumulative numbers, which accounts for an increase of 28,000 tests. Note that our numbers for tests only include those tests where results have been received from the laboratories. Here is a look over the past 2 weeks of case counts and trends in the region. Here's a picture of the Healthcare Coalition Northern Southern District's COVID-19 Resource Hub, which shows a similar map for additional counties in the Missouri Highway Patrol Region A. On Tuesday, May 26th, the Multi-Agency Coordination Group met to discuss our collaborative response efforts now and into the future. The MACG is scheduled to meet again on June 9th. Additional information about these public meetings is available on the public meeting calendar at www.marc.org. Our strategic objectives remain unchanged, but they continue to guide discussions and future actions. Lifelines. All lifelines are functioning as required, with no mission-critical shortages of personnel, equipment, or supplies forecast for the next week. Now I'll provide a brief update on supporting functions and disciplines. ESF8, Public Health and Medical Services, Public Health. As the greater Kansas City business community adjusts day-to-day operations in response to COVID-19, we must balance the need to maintain our region's economy with the protection of our community's health. The KC Chamber, KC Area Development Council, Civic Council of Greater Kansas City, and the Mid-America Regional Council are working together for #SafeReturnKC. Visit our Safe Return KC page to view reentry resources and download the Safe Return Guide and summary of initial reopening plans for our region. The Safe Return KC Guide provides a roadmap for organizations of all types across the region to use as we reopen our workplaces, while considering the public health needs of our workforce, stakeholders, customers, and the community. These pages, showing reopening plans by jurisdiction, are available at Prepare Metro KC. And these pages, showing a summary of gating criteria for each jurisdiction, are also available at Prepare Metro KC. Testing. Mid-America Regional Council is working with local public health directors and local federally qualified health centers to plan for the formation of 2 bi-state strike teams to augment local health departments with their outbreak management capacity. Testing information continues to be available for each local health department website and can be accessed on preparemetrokc.org. Additional test resources have been made available through states, resulting in increased testing. Testing resources are prioritized for hotspots and high-risk areas. Additionally, there are small green icons on the Resource Hub map. and those are the locations of testing sites. Click on the icon and a small window will open that provides information on testing location as shown in this panel to the left. Contact tracing. Individual health departments are reporting that they've hired more staff for contact tracing and recognize even more staff will be needed to meet the demands over the duration of the event. Public Health is exploring options to expand contact tracing to include working with private sector C19KC group. Their proposal includes smartphone-based Safe Paths contact tracing app. The health departments and partner organizations are evaluating additional resources through community organizations active in disaster or COAD. The CDC has released interim guidance through a contact tracing communications toolkit and has reported that CDC will deploy a small team to each state to provide guidance on contact tracing activities. Contact tracing web-based training is available through the Johns Hopkins University at the site shown. Hospitals. Staff report they still have COVID-19 patients and patients who are persons under investigation in area hospitals, though the rate of hospitalization has decreased. However, with hospitals increasing elective procedure, surge capacity is decreasing. ESF6, Mass Care, Emergency Assistance, Temporary Housing, and Human Services. For the homeless population, Missouri has 4 homeless sites established in the region, and Kansas has 4 homeless sites established in the region as well. Mass Care Feeding. The United Way of Kansas City COVID-19 Resources webpage includes information on school district meal provision, community food resources, and other basic needs. Emergency Human Services. Contact your local emergency management director, ESF6 lead, or KC Community Organizations in Disaster for additional information. Visit KC Regional COAD. Donations management messaging has been posted to preparemetrokc.org. This is ESF6 Common Operating Picture. It provides a wealth of information on donations and resources available throughout the region. ESF7 Logistics, Personal Protective Equipment. Federally qualified health centers and long-term care facilities are still reporting shortages of personal protective equipment. Some long-term care facilities and nursing homes have received their first shipment of the 14-day supply of personal protective equipment from FEMA. The Kansas City Regional Purchasing Cooperative issued bids and awarded 8 contracts to provide personal protective equipment for the COVID-19 response. A number of agencies and organizations have made purchases through the contract. Information on the cooperative purchase agreement and the potential PPE suppliers list have been added to a new page. Link to it from the Safe Return page on preparemetrokc.org. ESF14 Community Recovery. The ESF14 team is developing recovery plans and is meeting regularly to explore additional resources to help populations affected by COVID-19. Mid-America Assistance Coalition has received private donations to help with utility assistance. The recovery support functions comprise the coordinating structure for key areas of assistance during recovery. Their purpose is to support local governments by facilitating problem solving, improving access to resources, and by fostering coordination among state and federal agencies, non-governmental partners, and stakeholders. The ESF14 team is developing essential elements of information for recovery to track the status in the areas of economics, housing, health and human services, and infrastructure with a focus on transportation. ESF 15 Emergency Public Information. Reopening plans continue to be updated as things change. Public health officials are still learning how this disease evolves, necessitating changes in criteria as more is learned. The hashtag SafeReturnKC guide is a regional resource to help guide your businesses on how to bring back your workforce safely. Visit preparemetrokc.org if you need support with food, childcare, job loss, home learning, and more. The resources are updated daily. The Medical Reserve Corps is a national network of volunteers organized locally to improve health and safety in their communities. Medical Reserve Corps volunteers include medical and public health professionals, as well as other community members without healthcare backgrounds. Medical Reserve Corps units engage these volunteers to strengthen public health, improve emergency response capabilities, and build community resiliency. Our Medical Reserve Corps is currently on a 2-week rest cycle, but continues to recruit volunteers. For more information, visit their site. After action reviews. Collecting observations starts on day 1 and continues throughout the response. Lots has happened over the last 80+ days. Our memories are very forgiving when it comes to hard lessons that we've learned along the way. And while sometimes we're drawn into where we may have fallen short, the important takeaway from an AAR is learning what right can look like, so that the next time we can repeat those successes. We'll be looking at compiling a region-wide AAR focused on activities at MARC and the MAC, together with activities at individual jurisdictions and their collective outcomes. Our aim is for continuous improvement, something that propels us forward to do even better during the next region-wide response where all jurisdictions suffer the consequences of a major event. Remember hashtag SafeReturnKC. Stay kind, stay safe, and stay apart. I'll leave you with a set of pictures as a reminder of how to, or how not to, wear a mask. In closing, we remind you that we're posting these periodic briefings to the Prepare Metro KC YouTube channel. Please subscribe to the channel and sign up for alerts to receive notifications of future briefings. We'll monitor comments posted during the briefing videos for questions that we can answer in future briefings. Thank you for your attention. This concludes our briefing.